Good afternoon, everybody. Thank you so much for the opportunity to present. But I'm delighted to be here on behalf of the OT department and our academic partners in Trinity to discuss Empower, which is our self-management anxiety group programme that we run for community-based palliative care patients. I'm going to run quite quickly through the feasibility study that we recently conducted and then give you an idea what the next steps are for the research. When we talk about anxiety, it really belongs to that umbrella term of distress, which is in panic, anxiety, fear, depression. It's very common in non-malignant and malignant conditions. It's part of that cluster of symptoms of fatigue, breathlessness, pain, cognitive difficulties. It impacts on activities of daily living, key concern of an occupational therapist. And the research and what we've heard this morning is that self-management models should be applied to people with life-limiting conditions to improve their self-efficacy and empower them as well. So that came to our programme, Empower, which was created as a result of an 11-week audit where our OT input was provided for half a day to our old traditional style of daycare service. And really what we were doing one-to-one was anxiety management intervention. So why not create a group to meet this need? So Empower was a 4-week programme. It's 1 hour a week. There's an education and goal-setting component, which is at the core of that programme. And we really focus on re-engaging in meaningful occupations because they're the first things that go when someone becomes unwell. And it's facilitated in our OT departments between both sites. So we decided to conduct an action research feasibility study to evaluate Empower. And really, our inclusion criteria is quite simple. Community-based palliative care patients who are under our care in St. Francis Hospice Dublin who identify stress and anxiety as impacting on their daily activities. Exclusion criteria is people who don't identify stress and anxiety as impacting on their daily activities. Very, very simple. We use 3 main outcome measures, a quality of life outcome measure, an anxiety and depression scale, and a goal-setting tool that is familiar to occupational therapists called the COPM. Data collection took place, so pre-people coming to the group, they were asked to fill out those 3 outcome measures. After the 4-week Empower programme, they're asked to fill out those same outcome measures, and they were then invited to participate in a focus group looking at the acceptability of Empower. If anybody was too unwell to attend that, we asked them instead to fill out feedback forms. So between November 2020 and December 2022, 33 people participated in Empower. Originally, this was set up as a face-to-face group, but that beautiful thing called COVID came along, so we had to adapt fairly fast and move it online. So out of the 33 participants, 15 participated face-to-face, 18 were virtual, 11 completed pre- and post-assessments, 14 completed the pre- and post from the virtual side. 7 people didn't complete various reasons, deteriorating conditions, maybe they RIP'd, and 1 did not give consent to the research overall. So 25 people did complete pre- and post outcome measures. So that's what you will see in our statistical analysis in the next slide. And we did have 7 focus groups overall. And for anyone who didn't make the focus groups, they completed feedback forms for us. So the demographics was female dominated out of those 25 pre and post outcome measures. Cancer was the main group, followed very closely with respiratory conditions. The average age of participants was 63 years and the average sessions attended was 3.84 out of 4. So basically if we got them to 1 session, they tended to come to the 4 weeks. With regards to our statistical analysis, with the HADS, that's our anxiety and depression scales, so there was a statistically significant reduction in the anxiety from pre and post. We also, in our COPM, so this is a goal-setting tool used by occupational therapists, where basically we look at how people are managing kind of the everyday activities, and we ask them to identify up to 5 activities that they would like to work on, that they would like to improve upon, their performance, and how happy are they with their ability to complete that particular task. So we administered this pre and post, and what we found is that actually there was again a statistically significant improvement in people's performance of these goals and also their satisfaction with that. So people were doing more as a result of coming to Empower. There was a correlation between those 2 scores, and that part is not life-changing information because naturally, if you are able to do more, you're going to be happier within yourself. The research is all there to support that. I suppose the reason we found statistically significant scores or reductions in anxiety and improvements in occupational performance and satisfaction really can be found on our qualitative data. 3 main themes really came through from that. First of all, the impact of anxiety as a symptom. People describing being in their garden in the middle of the night, having panic attacks, calling ambulances because they couldn't breathe, they got so panicked. What was interesting, and this wasn't part of our focus group, but what came up naturally in the conversation is when people were asked, well, people were like, I didn't really want to come to a hospice, or I felt a bit silly going to an anxiety management, I should be able to manage this. And actually that came up quite naturally when they were in the hospital and they were approached by a palliative care consultant. It frightened the living daylights out of them. So our very skilled focus group facilitators would flip that question and say, well, why then did you come to this program? What made you come? And that lovely thing called competition. People wanted to measure their anxiety levels with other people. Did they have good anxiety? Did they have bad anxiety as well? Our second theme was around that management of symptoms. So really we saw, as a result of Empower, people were really utilising the strategies that we were teaching them in the group. So whether people were experiencing pain, they naturally would turn on their relaxation track and listen to it. And after 5 or 10 minutes, the pain would go away. Or they would take their medication, put on the relaxation track, and within 20-25 minutes, they felt the effect of it as well. What was very interesting, people's attitudes changed as a result of coming to Empower, in that they now realised they had the tools to make these changes, and actually I can make this change. It's not up to anyone else, I can do this for myself. And what was lovely to hear is people went back to some valuable occupations, people feeling they were back to normal. They were back driving with their oxygen cylinder. They were going down to the pier to get ice cream with their husband or wife. If they're baking, cooking, they felt they could do those things. With regards to the programme, so our final theme was the programme's design and delivery. That peer support element was just huge, and it dominated the results as well. Really being able to sit beside someone who could validate what you were going through. As OTs, we can only go so far with our patients, but to sit beside someone who gets it was invaluable, or even to talk to someone virtually was invaluable. People really enjoyed the goal setting. I don't have enough time to go through the exact layout of Empower, but every time at the end of a session we set a goal with the patient, and it might be to incorporate some of the strategies they've just learned, or it might be to work on something that's important to them, and people really, really love that. They applied it to their everyday lives. It might be that they got a new rollator and they wanted to go and practice using it in the back garden. Perfect. We did ask about the format because we did have to make a sudden switch online with COVID, and actually people really liked the Zoom element, which surprised us. But still what kind of did come through is that if we had the option, I would have preferred to do this in person. But nevertheless, when people had to move online, they were very happy to do so. And then we asked, well, what would you change about Empower? What could we do differently? And again, very strong information came back that really we wanted this to be stretched out. 4 weeks is a lot of information. There's a lot of content. As therapists, we agreed with that as well. And also people wanted more time for relaxation, because we used to do the last few minutes, would do a relaxation piece with them as well. And people absolutely loved the relaxation as well. As Fergal has very kindly noted in his speech, we did publish this information, this data, in the BMJ just there in April 2025. So bedtime reading for everybody as well. But so what? Where are we going with this? What's the next step, really? So we've changed Empower. You know, we've listened to the feedback and we said, well, if 4 weeks is a lot of content to cover, let's move it to 5 weeks. We're seeing patients are attending it. We know that once they come to one session, they'll come to the others. So we've now moved it to a 5-week program. It is still 1 hour long. But we've given more time to relaxation. That was so clear in the feedback to us. They want more time for relaxation. They want more time for that interaction and that discussion, that peer support element. And also, we've decided to take this to make it a multi-site research study. And this has kind of come about, one, the data we've collected, although it's 25 participants, fantastic number, but it's not generalizable, let's be honest. So let's go and take this and make it a multi-site research study. We've also had a lot of interest from other OT departments and specialist palliative care sites who want to know about Empower, who want to run it as well. So we thought, why don't we show them how to run Empower, and let's collect the data and see what works. But also we want to know what therapists think about Empower as well. We know what the patient feedback is. What do therapists think about this program as well? So that's exactly what we did. In March 2024, we opened up an expression of interest to all OT departments in special palliative care sites in the Republic, saying, would you like to participate in this research study? We will show you how we will roll out the Empower programme. We'll show you how to do it. We will give you all the training. We will support you. What we ask is that you collect the data from the outcome measures, and could you send them to us as well, anonymously, of course. So 7 sites came back and said, yes, we would absolutely want to be a part of this research study. So we have 8 sites in total. That's obviously including ourselves. Then in September 2024, we developed our training programme, and this is actually starting to train therapists in how to run the Empower programme, showing them all the documentation, the outcome measures, everything we could. At the same time, in St. Francis Hospice, we were applying for our own central ethical approval in order to conduct this multi-site research study, which we got in April 2025, which is great. And up until May, we have now trained 23 OTs across the 7 sites that have expressed an interest, and our data collection has actually just started this month as well. So hopefully in a couple of years' time, we'll be back again with some very good results, hopefully. But really, it's just to emphasise, and again, I'm conscious of time, so can't go into too much information. But really, stress and anxiety does impact on our palliative care patients. Maybe it's a symptom we don't often ask about, but it does dominate and it really does have an impact. And Empower is considered an acceptable intervention by community palliative care patients, both virtually and face-to-face. And the fact that we can offer it now as both, and we've trained the sites on how to offer it both, is huge as well. And particularly, I will say, just on the virtual, when we were running it, it was through the height of COVID. So naturally, anxiety levels were quite high. So actually, it kind of helped as well with that piece, that we could still reach our population, but reach them in a virtual way as well. Statistically significant improvements were noted in anxiety and occupation performance and satisfaction. Obviously, that's really lovely to see, but it is a small number of patients that were recruited. So we're waving the red flag saying this looks really good, but we need to do the more research and we need to collect more data. And that is what we're going to do, is to evaluate the impact of the new Empower programme through this multi-site study. So thank you so much. Great question. I knew that was going to come up. No, not at the moment. It doesn't extend to the north. We've kept it within the Republic. The training programme, though, is still ongoing. So we literally just did our last session, was it 2 weeks ago, as well. So it is still, at this point, I think most of the 7 sites have been trained up. But there are plans. We would be very much looking to bring this to a northern aspect as well. Yeah, it's something that we've definitely considered, I suppose, as well. We've been a little bit, I suppose, hesitant about it. We would certainly offer feedback to families, and that when they come in to drop off their loved one, about how they're progressing. I suppose, in a way, we've hesitated to bring in families just yet because of the subject. It's anxiety management, and a lot of what is that anxiety element is related to families and how to manage families and that as well. So I suppose we're very conscious that it's important for people to have that forum to be able to discuss it, and with their own fellow patients as well. But that's not to say in the future we wouldn't rule it out either as well. I think there's a huge component piece. We do give everybody in the group a booklet, and everything we discuss in the 5-week programme is in that booklet. And we do say to our patients, leave it on the coffee table, leave it on the kitchen table, let family read it, let them know about this symptom and what's happening as well. But I think definitely we will look to have some kind of care element in the future. They're pretty sick of us, but no, I'm joking. Yeah, I suppose really it's our clinical reasoning. At the end of that 5-week programme, whoever is the therapist facilitating it makes the call to say, actually, I think they'd really benefit from more one-to-one follow-up, or maybe they might need it in a couple of months' time. Not hugely that happens a whole lot as well. Other times people may come to the 5-week programme and they've really benefited from it, that we would almost say, you know what, we'll step back now, we're going to discharge you from OT, but we're always on the periphery. So if someone really feels they need it again or needs that one-to-one input, we're happy to step back in as well. Yeah, it's a very good point. I suppose the core of what Empower is really that focus on re-engagement and meaningful occupations. That's at the core of what the programme is. So in many ways, it is kind of, I suppose, more suitable for an occupational therapist to facilitate it, because we're analysing, we're using our activity analysis a lot of the time with the goal setting. That it's not to say in the future it couldn't be, but I think for the moment, because of what the core element of Empower is looking at, in that re-engagement in those meaningful occupations, those meaningful activities, daily living, I think it will be within the OT realm for the moment. But listen, we won't say no yet, but I think for the moment it will be an OT-led programme, yeah.